Hi all, welcome to Edgevis Academy and welcome to the question discussion session. So let's see the first question. The nurse is caring for a client who has been placed in skin traction. Which action by the nurse provides for counter traction to reduce shear and friction? So the question is regarding the intervention to prevent shear and friction. Option A, using a footboard. B, providing an overhead trapeze. C, slightly elevating the foot of the bed. D, slightly elevating the head of the bed. Okay, so let's see what is shear and friction. Okay, friction occurs, you all know about friction. Friction occurs when an object is dragged or rubbed across the skin. Okay, shearing means when there are two opposite forces applied to the skin. Okay, shearing won't occur when forces are applied to body tissues or parts that cause these tissues to move in opposite directions. So because of the weight which is applied in the traction, you can see in this picture, because of the weight applied in the traction, there will be an opposite force by this weight. See, so this pressure is known as shearing. Okay, the body will pull backward and the weight will pin forward. So this force is known as shearing. Friction means the skin rubs against the surface of the bed. So you can see the mattress here, and in order to prevent the friction, you can see there is a blanket or pillow which is supported under the leg. And what are they doing? The extremity is slightly elevated. Extremity is elevated for to prevent this shearing force, and the blanket is provided to prevent friction. Okay, so coming to the question again. The nurse is caring for a client who has been placed in skin traction. Which action by the nurse provides for counter traction to reduce shear and friction? So as you have seen in this picture, what we do is slightly elevate the leg of the bed. So option C is the right answer. Slightly elevating the foot of the bed. Okay. Next question. The nurse is preparing to initiate a bolus enteral feedings via nasogastric tube to a client. Which action represents the safe practice by the nurse? So the scenario is regarding NG tube client. Nurse is preparing to give bolus enteral feedings. So which action represents safe practice? A, checking the volume of residual after administering the bolus feeding. B, aspirating gastric contents before initiating the feeding to ensure that pH is greater than 9. C, elevating the head of the bed to 25 degrees and maintaining that position for 30 minutes after feeding. D, verifying correct NG tube position with aspiration, administration of air bolus with auscultation. So this is the scenario. Nurse is preparing to give bolus enteral feeding. So what is the safe practice by a nurse before giving that bolus feeding? That is a sick. See, if you see the options, check the volume of residual after administering the bolus feeding. We all know that we should aspirate gastric contents before we give every feeding. So option A is wrong. Aspirating gastric contents before initiating the feeding to ensure that pH is greater than 9. So the pH of normal pH of stomach should be less than 7 because the content of the stomach, which is gastric juice, is acidic, so it should be maintained less than 7. Normal pH is 7. So option B is also wrong. C, elevating the head of the bed to 25 degrees and maintaining that position for 30 minutes after feeding. It's not required that you should maintain that position for 30 minutes. So option D is the right answer. Before giving the bolus, verify the correct NG tube position. And how should we ensure the correct position of NG tube? With aspiration, administration of air bolus with auscultation. See, initially when the NG tube is inserted for the first time, the most proper method to identify the location is taking the chest X-ray. After that, before giving bolus feeding, you should again verify the correct position with aspiration, air bolus and with auscultation. So answer is D. Next question, the nurse is caring for a client with terminal condition who is dying. Which respiratory assessment findings should indicate to the nurse that death is imminent? Here more than 4 options are there, and the question is what are the assessment what are the respiratory assessment findings that indicate that death is imminent, means not avoidable? Okay, so there are 6 options: dyspnea, cyanosis, tachypnea, Kussmaul's respiration, irregular respiratory pattern, adventitious bubbling lung sounds. Okay, adventitious bubbling lung sounds means, adventitious means abnormal or dangerous lung sounds. Bubbling lung sounds indicate crackles, which is commonly seen in pulmonary edema. So here the question is about the respiratory assessment findings that indicate death is imminent. Okay, so let's see what are the serious symptoms here. Options will be option A, dyspnea is one of the initial problem. Option B, cyanosis, because of lack of oxygen supply, cyanosis occurs. E, irregular respiratory pattern. And F, finally, adventitious bubbling lung sounds, which means pulmonary edema, which is a life-threatening conditions. Okay, so let's see which one is the correct answer. Options are A, B, E, and F. So these are the serious or complicated respiratory findings which indicates it's life-threatening. Okay. Next question. A client at risk for respiratory failure is receiving oxygen via nasal cannula at 6 liters per minute. ABG results indicate pH 7.29, PCO2 49, PO2 is 58 mmHg, and HCO3 is 18 milliequivalent per liter. So what intervention should the nurse anticipate that the primary healthcare provider will prescribe for respiratory support for this client? Okay, so while seeing the ABG, it's clear that the patient is having respiratory acidosis. Let's see the options first. A, intubating for mechanical ventilation. B, keeping the oxygen at 6 liters per minute via nasal cannula. C, lowering the oxygen to 4 liters per minute via nasal cannula. And D, adding a partial rebreather mask to the current prescription. So while seeing the ABG values, we can see that pH is decreased, PCO2 is increased. So it's respiratory acidosis. But what we have to think is that here the value of PO2 is 58 mmHg. So the patient is having respiratory acidosis, which means there is excess carbon dioxide in the lungs because of difficulty to breathe. So the initial management of a patient with respiratory acidosis is intubation and ventilation. So intubating for mechanical ventilation is the right answer. Intubating for mechanical ventilation. Next question. During a routine prenatal visit, a client in her 3rd trimester of pregnancy reports having frequent calf pain when she walks. The nurse suspects superficial thrombophlebitis and checks for which sign associated with this condition. A, severe chills, B, kerning sign, C, Brudzinski sign, and D, palpable hard thrombus. So during pregnancy, a patient is having calf pain, which indicates DVT or superficial thrombophlebitis. So which assessment is associated with this condition? That is the question. So if you see severe chills, chills can be seen in any kind of infection. B, kerning sign and Brudzinski sign, both are the significant clinical manifestations which are seen in meningitis. So remaining option is D, palpable hard thrombus. So option D is the right answer. Nurse evaluates the patency of peripheral intravenous site and suspects infiltration. Which action should the nurse take to determine the IV has infiltrated? A, strip the tubing and assess for a blood return. B, check the regional tissue for redness and warmth. C, increase the infusion rate and observe for swelling. D, gently palpate the regional tissue for edema and coolness. So most common complications while we administer IV line is infiltration, and second is phlebitis, and third is extravasation. So what are the features that occur during these conditions? We will see that in detail. First, let's check the answer. Answer is option D. Gently palpate the regional tissue for edema and coolness. Okay. So let's see what is infiltration, what is phlebitis, and what is extravasation. First thing, phlebitis means inflammation of vein. The clinical features associated is, this is the most important part, increased skin temperature and redness. In infiltration, what happens in infiltration? Leakage of intravenous solution or medication into the extravascular tissue. Okay. While giving injection, the needle might puncture the artery and the medicine will go to the adjacent tissues, which is known as infiltration. Here the features are edema and decreased skin temperature. In phlebitis, it is increased skin temperature, and in infiltration, it is decreased skin temperature. So that's why in this question, the answer is gently palpate the regional tissue for edema and coolness. Next question, a client who has sustained a neck injury is unresponsive and pulseless. What should the emergency department nurse do to open the client's airway? Okay. Insert oropharyngeal airway, tilt the head and lift the chin, place in recovery position, stabilize the skull and push up the jaw. So here the patient is unresponsive and pulseless, so the nurse is preparing to open the airway. So which method should the nurse use? That is the question. So answer is option D. Why? Inserting oropharyngeal airway is not possible because we have to open the mouth for that. Okay. Tilt the head and lift is contraindicated in neck injury because tilting the head might cause severe injury to the neck. Okay. Place in recovery position, which will not help the airway to open. So as the patient is having neck injury, first we have to do is stabilize the skull and push up the jaw. So option D is the right answer. Usually what happens is that when the patient becomes unconscious, there are chances that the tongue might go backward, which is known as tongue fallback, which obstruct the airway. So in order to pull out the tongue which has fallen, what we have to do is stabilize the skull and push the jaw up. Next question, the nurse is caring for a child diagnosed with Reye syndrome. The nurse monitors for manifestations of which conditions associated with this syndrome? Okay. Child diagnosed with Reye syndrome. Which of the manifestations are associated with this syndrome? Reye syndrome is conditions which occur in children. The most common risk factor of Reye syndrome is aspirin. Aspirin might cause Reye syndrome. So children's aspirin is contraindicated in children's. So what happens is in Reye syndrome there are two conditions associated. One is hepatotoxicity and second is encephalopathy. So what are the conditions related to those two conditions? Let's see, protein in the urine, B, symptoms of hyperglycemia, increased intracranial pressure, D, a history of staphylococcus infection. So I said in Reye syndrome there are two conditions, encephalopathy and hepatotoxicity. So as there is damage in the brain, the chances are that the first thing that will occur is increased ICP. So here answer option C is the right answer. See here, it's a definition. Reye syndrome, also known as Reye syndrome, is a rare but serious condition that causes swelling in liver and brain. Reye syndrome can occur at any age but usually affects children and teenagers after a viral infection, most commonly flu or chickenpox. Okay. Another important risk factor is, just like I mentioned, aspirin. And therefore aspirin is contraindicated in, this is also an important point, aspirin is also contraindicated in children because it might lead to Reye syndrome. So here most probably it occurs as a result of viral infection. So that's why here the answer option D is wrong. So because there is swelling in the brain, the answer is increased ICP or intracranial pressure. Next question, the nurse analyzed an electrocardiogram for a client demonstrating a left-sided heart failure and interprets the ECG strip as which rhythm? So you have to identify the ECG and say which cardiac arrhythmia is this. So here the answer is atrial fibrillation. So the features of atrial fibrillation means the atrium will not be able to contract properly. And the wave which indicates atrial contraction is P waves. So in atrial fibrillation, because the atrium is not properly contracting, P waves will be absent. So first feature is absent P waves. And second, because the atrium is not contracting properly, it will affect the heart rate. And how do we assess the heart rate? By seeing the RR interval. This is RR interval, and we will count the boxes in between. We will study detail about ECG later. So if you look at the boxes, just look at the width of the RR interval. For EC method, just look at the width. For every RR interval, the width becomes different. So second feature of atrial fibrillation is irregular RR interval. So these are the two important features of atrial fibrillation. If you see, there is no proper P waves in any of the lead. In all this written, there is no proper P waves. So these are the two features of atrial fibrillation: absent P waves and irregular RR interval. Okay.